Hi everyone, this is Priyanka. Welcome back to Hygiene and You. Today we have a very special guest with us, Dr. Kiran Kukreja. She is a very well renowned gynecologist of South Delhi. She's also been the president of Indian Medical Association, and she does a lot of community work in women's health, family planning, and menstrual hygiene management. Today we'll be discussing all the birth control or contraceptive methods with her. Doctor, what is birth control and why is it needed?
Hello, viewers. Birth control, as the word itself signifies, is controlling the birth or preventing a pregnancy. Why is it required? Well, we want space between two children, and if you have had a complete family, you don't want more children. So, that is the main reason for which we should have birth control or contraception.
Thank you so much. What are the various birth control methods or contraceptives available?
If we see the Indian scenario and the market, well, we have a basket full of contraceptives. All over the country, we have family planning centers where most of these facilities are available for free. And we want everybody to please go there and get information, or to your doctor. Without consulting a doctor, you should not go for contraceptives, because it is a tailor-made condition. We cannot use everything for everyone. If we go for long-term contraceptives, the best which is used is copper T, IUCD, which is intrauterine contraceptive device. This is from anywhere from 3 years to 10 years now available, and it is a very easy method. It is a small device which is inserted in the uterus. Other long-term, of course, permanent methods are vasectomy and tubectomy, where we just cut or occlude the tubes and the egg cannot come to the uterus, or the sperm cannot be ejaculated in the semen. Other short-term commonly used method is pills, which is hormonal. So the pills are of two types. They are either a combination pill which consists of estrogen and progesterone, or there are mini pill or progesterone only pill which contains only progesterone, which we would recommend to the lactating mothers. Combined pill is very commonly used as contraceptive for even young girls, the adolescent girls who are, too much into this sexual activities, and they have to prevent pregnancy. Pills is a very safe, reversible, common, and of course financially also sustainable method for girls. Emergency contraception pill is a pill available at the chemist over the counter, and I see girls and women consuming it, left and right, which is not good at all. It's a very heavy hormonal tablet. It has to be used only in emergency, not to be used as a routine contraceptive pill. Only when, supposing she has missed her pills, or if a condom has burst, in those cases she is advised to take. But along with this, I would also like you to be having knowledge of the fertility period. If you are aware of your cycle, menstrual cycle, if it's regular, you should have an idea when you are ovulating. The egg is forming only on the it bursts on the 14th day. It starts forming right after your menstruation. So if you avoid sex during that period, 1 week, say 11th to 17th day, or you use some other contraception during that period, you will not get pregnant. This is a very good method if you are aware of your menstrual dates. A condom is a method used by males. It's made of latex rubber. and it can be used very easily, but of course it has a high failure rate. There are about 20% failure rates in condom. If the condom breaks, bursts, there is always leakage, so all that has to be taken care of. But the advantage with the condom is that it is also preventing sexually transmitted diseases, which no other method does. Also, injectables are given where copper T is contraindicated. Injectables contain progesterone. They are given every 2 to 3 monthly, depending on what strength we are giving.
Okay, that was actually great information. I had no idea we had so many different methods of contraception. So, doctor, are all of these methods safe to use or do they have any side effects? And are there any situations where a woman or a man should not go for any particular method that you just mentioned?
All these contraceptive methods are very safe, but as I said, depending on the woman's health, we have to decide which one is good for her. So, a counseling session is very, very important. Like I said, copper T, it cannot be inserted if she is having a pelvic inflammatory disease, if she is exposed to some sexually transmitted disease or infections, if she is having very painful and excessive menstrual flow. Also, the oral pills is a hormonal combination, estrogen and progesterone, which we cannot recommend in some cases like diabetes or a elderly lady who smokes, or somebody who's overweight and doesn't want to gain more weight, because long term hormonal therapy may lead to slight weight gain also. Latex condom rubber is sometimes gives allergy. So if one male is allergic to condom rubber, of course it's contraindicated. There are condoms made of other polyethylenes also, which we recommend in that case.
Okay, so I had a question that you said if the man is allergic to latex or rubber, then he cannot use condoms. So, and I think that would apply for the woman as well, right? If the female is allergic to latex or rubber, then even in that case, the man should not use the condom?
Yes, of course. If she has any problem because of that latex rubber, it is contraindicated. Sometimes ladies do come with urinary tract infections and itching in the vulva or white discharges after husband has used condoms. So we tell them not to use that and adopt some other method.
Great. Can you tell us a bit more about temporary versus permanent methods? And will it be easy for a woman to conceive after she stops using those?
Temporary methods are all these methods which we have just enumerated, except the long term methods are tubectomy, sterilization, vasectomy in males, and tubectomy in females. These are the long term. Other long term reversible method is copper T. When copper T is removed, whenever she wants the next child, she is ready to conceive again. The fertility comes back soon after. All these methods are reversible, except, as I said, tubectomy and vasectomy, which are permanent methods.
Okay, can you shed a bit more light on all the methods that a male can use as compared to which ones are the methods used by females?
There are very limited methods for males. Like I said, condom, which is widely used by males. There are female condoms also, just for your information. These are available at the chemists. They are more expensive than the male condom. It is about, say, 2 condoms in 100 rupees. So it comes about 50 per condom. It's a huge big one, and it's inserted by the female in a very comfortable position, either lying down or with standing with one foot on a chair, and the condom is placed inside snugly, and the margins of the condom are outside, covering the labia, so that the ejaculated semen doesn't seep from outside as well. Other method by males is only vasectomy. There are the spermicidal jellies and creams which are supposed to be applied before having sex, and these jellies will kill the sperm or reduce their motility and the movement to travel into the tubes.
Thank you so much, doctor. Your answers have been very informative, and I hope our viewers have watched this thoroughly and they're going to make the right decision and choose the right birth control method for themselves.